Okay, today we're going to talk about classification of injuries. A commonly used medical classification system for injuries uses two major categories, acute and chronic. Remember, we talked about these. Acute or chronic. Acute are injuries that happen very quickly or at that moment in time. Chronic happen over a longer period of time. Remember what they say, acute injuries have been defined as those characterized by a rapid onset resulting from a traumatic event. Acute injuries are usually associated with a traumatic event followed immediately by a pattern of signs and symptoms such as pain, swelling, and loss of function in that joint or appendage. For acute injuries to occur, critical force must be met in order to damage a structure within the body. So if you remember what we talked about, the forces of injury, you have to have a critical force, one of those three, for the injury to happen. Such as demonstrated in the following videos. We're not going to watch a video, so you can skim over that and ixnay that. Chronic injuries have been defined as those characterized by a slow, insidious onset implying a gradual development in structural damage. Typically, these types of injuries are seen in those athletes who must compete repetitive motions such as running and cross country. So they're constantly running, constantly doing some kind of activity over a long period of time. Consequently, these injuries are also referred to as overuse injuries, implying that the athlete has simply done too many reps of a given activity. Overuse injuries in tendons occur when the workload from exercise exceeds the ability of the musculotendinous structure to recover, thus eventually leading to failure of these tissues, meaning that they occur in the tendons and in the muscles right where they attach to each other, a lot of times because there's too much work for those areas and they're not used to it. A few common sites of these types of injuries include the Achilles tendon in the back of the heel, the patella tendon just underneath your kneecap, and the shoulder complex. You see this a lot of times in people who pitch or throw footballs, who do a lot of those kind of activities. Here's a picture right here of tendonitis. This is your patella tendon. This is a side view of your knee. And I believe this would be the medial side, because you can kind of see the fibula kind of over to the outside. It's kind of on the back side, so that's why this is the medial. And what you have here, there's your patella and there's your patella tendon, and when it gets overworked, you can get tendonitis in the patella tendon. It's very common, especially in running athletes. Catastrophic injuries. These types of injuries involve damage to the brain and or spinal cord and are potentially life-threatening or permanent. A lot of times you see this when people hit head-to-head. Two types of catastrophic injuries. First is direct, occurred due to the skilled participation in a sport. Neck fracture, contusion, etc. Any of those kind of things where somebody may hit head-to-head, or somebody may hit head-to-shoulder, and the person who hit with their head comes up with an injury. Indirect, systemic failure resulting from participation in sports. Heat illness, kidney disorder. So this is when your body starts shut down and it causes injury to the brain indirectly. So it's not a direct result of hitting somebody. Indirect. Right here you see a picture. This looks like Colorado University. I couldn't give you a lot of history behind this picture, but obviously this person has been involved in some kind of head injury and some kind of catastrophic injury, because you can see them holding the player's helmet on the sides to stabilize his neck. And that usually is a signal of some kind of catastrophic injury when they have to do that because they're worried about injury to the spinal cord. The next step in learning the basics about sports injuries is being able to define different types and figure out the extent of damage to a structure. What I like to throw in here is what people think I do. When they say athletic trainer, they think I teach people how to lift weights. What the fans think I do, they just think that I work on sprained ankles and people on the field. What athletes think I do, they just think I hand out water like Adam Sandler in The Waterboy. What my mother thinks I do, she thinks I provide first aid CPR for people who go down on the field. What I think I do, I feel like I'm doing surgery all the time. It's more important. But probably what I really do is just hand out ice bags like this guy's doing in this picture. We'll stop right there.